Hi, my name is Latan. I am 22 years old and a senior at the University of Michigan, and I'm going to tell a few anecdotes describing my struggle with an eating disorder. I was diagnosed with it at the age of 13, and it lasted from when I was in 7th grade until I was in 8th grade. So I ended up being 10 pounds underweight, but unlike the narrative that we commonly hear, I didn't purposely lose that weight. I simply just didn't feel hunger, and when I did finally feel a twinge of hunger, once I asked for food and had it in front of me and saw it or smelled it, I would very frequently get nauseous and start vomiting. And this made it incredibly difficult for me to eat food and made my mother very concerned. In the midst of this problem, my family and I went to Tomatoes, a pizza restaurant we frequented together. When one walks inside, the restaurant emanates with pizza smell. Normally, it's a smell I cherish, but with my eating disorder, it was a recipe for disaster. We walked in, and once I smelled the pizza, I immediately started feeling nauseous. We stood near the register deciding what we would buy before going to sit down, in a similar way to Panera Bread's process of buying food. I tried to last as long as I could, and endured our decision-making process about what pizza we would buy, and managed to control my body while we ordered. But after a good 3 minutes, when my mom was finally paying at the register before we would imminently sit down, I ran to the bathroom. Unfortunately, I didn't quite make it to the toilet and proceeded to vomit on the bathroom floor. This anecdote is a perfect example of the embarrassment and confusion that I experienced during this time. I had no clue what was happening to my body, and I felt unhappy because I wanted to eat but I couldn't. My eating disorder was involuntary, and there was clearly a psychological issue at hand. So, eventually, my mom had me see a therapist, which was great in one sense, but at the same time, it wasn't as effective as it could have been. The problem was that I wasn't honest about everything because I wasn't really good at talking about my feelings. The problem was that my parents didn't really teach me to ever talk about my feelings. It's not something or a value even that I grew up with. But regardless of whether or not it's my Middle Eastern parents' fault that I'm terrible at opening up and being vulnerable, I think spending most of my life in the United States can be partially to blame for this difficulty I have with being open to. We need to talk about talking about feelings more in the United States, and by that, I mean talking about our feelings in a more honest and raw manner than we do today. You know, ever since I came to college, I've noticed this phenomenon in which people often ask me, "How are you?" as they walk in my direction on the sidewalk. And often I'll eagerly respond, "Oh, I'm doing well today," or "could be better." And then when I finally ask, "How are you?" back, the person frequently either ignores me or says "good" or "fine" and just walks away. Like, what is even the point of that? "How are you?" is definitely the most disingenuous phrase I've learned in the United States. My point then is, how do we expect therapy to work for people who won't even open up about their feelings, you know? Anyway, as I said, my mom took me to therapy, and I talked about my life with Dr. Scouten. The environment was very relaxed, and she was incredibly professional. Despite being 14 and speaking to a 60-year-old, I actually felt very comfortable and even looked forward to speaking her on some days. She even gave me a Rorschach test, which I didn't know were still considered to be accredited. So, eventually, after several months of coming in, She told me and my mom that I have a fear of growing up. Now, it's not like I necessarily disagree with her. I mean, this was a problem that manifested itself in several ways in my life. For example, I would wear sports bras 24/7 to try and stop my boobs from growing. And I was just generally embarrassed and confused that my body was changing and that I was going through puberty. But I also feel like this wasn't an uncommon experience. And that may have been a different problem entirely. Like maybe that was a failure of sex ed from when I was younger. But I wasn't unique in experiencing this problem. So, while I don't think Dr. Scouten was wrong that this was a problem I experienced, I still don't think this was an absolute cause of my eating disorder. My eating disorder could have been an intersection of many problems, but really, isn't everyone scared of growing up? I just don't really like that explanation for my eating disorder. I really do think something else was going on during this time in my life. You know, in retrospect, I realized that at this age, I really didn't have very many friends. And when I finally did make some great friends of mine in 8th grade, my eating disorder did stop. So, it may be that my eating disorder could have possibly been attributed to this issue of not having friends and not feeling like I had anyone to talk to or laugh with. Now, the reason why I wanted to talk about my eating disorder is because I've noticed that in the United States, when we talk about health in terms of eating disorders, we often talk about them developing in teenagers or women because they want to be skinny or are unable to view themselves as skinny when they are. But sometimes eating disorders can occur as a result of other reasons, like in my story. At no point did I ever feel fat during the time that I did have my eating disorder. On the contrary, my metabolism was actually incredibly quick at this time, so I was already quite skinny. Another reason why I wanted to discuss this topic is because I wanted to make the struggle of eating disorders more tangible to those who've never had one and find it difficult to empathize with those that do. It's important to note that eating disorders come in many forms, and every eating disorder is experienced entirely differently. So I want this to be just one narrative. I'm not trying to generalize for all eating disorders whatsoever. And I hope that in the future, after listening to this narrative, you're able to continue life in this world with at least a slightly more colorful perspective on eating disorders. Thank you for listening, everybody.